What if one of the most effective treatments for hair loss isn't a pill, a serum, or even a transplant, but a small tool you can easily buy online? Microneedling is often overlooked in the hair restoration world, but in this video, I'll cover the science, protocols, and results. So by the end, you'll know how to safely and effectively incorporate it into a hair loss routine. Let's start with what's actually going wrong. Androgenetic alopecia is by far the most common cause of baldness in both men and women. You've got a mix of factors: sensitivity to dihydrotestosterone, inflammation, poor scalp blood supply, and impaired signaling to the follicular stem cells in the bulge region. The result? Follicles shrink and eventually enter prolonged rest, or catagen phase, producing shorter, finer hairs until growth stops entirely. With telogen effluvium, the second most common cause, the problem is a shift in the hair cycle. Follicles prematurely enter resting phase due to things like stress, illness, or nutrient depletion. What's exciting is that microneedling appears to help both of these processes. Microneedling uses fine needles to create controlled micro-injuries in the scalp, triggering a healing cascade without damaging deeper tissues. Options include derma rollers, which are good for home use and easy to buy online, and derma stamps and motorized pens, which allow variable depth and faster coverage. Regardless of the method, the principle is the same: stimulate regeneration and improve the delivery of topicals. Let's look at the research. Durat et al. 2013, a randomized trial of 100 men with androgenetic alopecia, where one group used 5% minoxidil alone and the other used it plus weekly microneedling. After 12 weeks, 91% in the microneedling group saw over 50% improvement, while only 4.5% saw that level in the minoxidil-only group. These weren't just subjective, hair counts confirmed the results. Fakigi et al. 2020 found that PRP combined with microneedling outperformed PRP alone in both hair count and satisfaction. Importantly, most studies combine microneedling with something else, so we don't fully isolate its solo effect. That's why Kim's mouse study stands out. It showed microneedling alone reactivated follicle growth via the Wnt beta-catenin signaling, a key stem cell pathway. A 2021 systematic review published in Dermatology and Therapy analyzed 22 studies. Most looked at microneedling as an adjunct with minoxidil, PRP, or growth factors, and nearly all showed benefit. Of the studies that used microneedling alone, only about half showed a response, likely influenced by needle depth, session frequency, and total duration. Interestingly, penetration depths around 0.6 millimeters performed better than deeper needling, and the type of device didn't matter as long as the depth was consistent. Here's what's happening under the skin. The needles cause control injury, triggering a release of growth factors like VEGF, promoting angiogenesis and better nutrient supply, PDGF, and TGF-beta, which guide cell proliferation and healing, and crucially, Wnt beta-catenin signaling, which reawakens dormant hair follicles. Plus, microneedling massively enhances absorption. Think of it like opening tiny channels in the skin. So when you apply minoxidil, peptides, or even exosomes afterwards, they're far more bioavailable. So how do you actually use this in practice? Depths of 0.5 millimeters are fine. A frequency of once a week would be acceptable. It doesn't matter if you buy a dermal roller from Amazon or more expensive microneedling. Keep the procedure sterile. I often pair this with low-dose topical minoxidil, nutritional support, and LED hair caps to maximize blood flow. Results are usually seen around 12 weeks, with best outcomes at 6 months. From a clinical perspective, I've seen some of my best non-surgical results when microneedling is added early, especially in the frontal and vertex regions. It's not a cure-all, and it won't reverse late-stage baldness, but an early to moderate thinning or as part of a regenerative plan with PRP or exosomes, it's genuinely impressive. One of the biggest advantages, it's safe, relatively low cost, and can be tailored to the patient's needs and risk profile. Just remember, like any hair treatment, it takes time, and it's the consistency that makes a difference. So to wrap up, microneedling works, both by itself and as a powerful enhancer for other treatments. It's backed by evidence, mechanisms, and clinical use. And most importantly, it gives patients more options, especially when they're not candidates for medication or transplant. I hope you found this video helpful. Feel free to leave your questions in the comments. And if you've tried microneedling yourself, whether as a practitioner or patient, let me know what your experience has been like.